My name is Dr. Chris Jenkins, and I am the CEO of the Orianne Society and the host of the Snake Talk podcast, the podcast where you learn about nature's most feared, maligned, and persecuted animals. I invite you to listen to this conversation, and maybe you'll find that what you perceive as fear is actually rooted in a deep fascination. Welcome to the Snake Talk podcast. I am here with James Reid, who is the executive director of the Global Snakebite Initiative. And as all of you know, I've had a pretty much lifelong, maybe fear as a child, but a fear that transformed into an intense fascination with venomous snakes. They're my favorite group of animals on the planet, and I've been working on them for a long time. And along with that, I've really been interested in snakebite, and I've been learning a lot about it over the years, and I've been fascinated in snakebite treatment and how that might vary in different parts of the world, and human health related issues, and on and on. So I'm excited to talk about GSI, again, Global Snakebite Initiative today. Excited to have James on here. I think we're going to learn a lot. So welcome to the podcast, James. How you doing today?
Thanks, Chris. Great. Cold, rainy San Francisco. Just wish it was summer. Yeah,
it'll hopefully be here before you know it. It's actually kind of cold and rainy today in the Appalachians as well. So I guess more warm and rainy, but it's rainy.
Yeah. I wish I was I wish I was probably on the ground in Kenya in our project right now, because it's in the 90s. So
yeah, you and me both. Maybe we should just go there and record this. But
I know how to get there.
I like to start our episodes and talk to my guests about exactly how it is where they get to where they are today, because I say in a lot of the episodes, but those of us that work in some form or fashion with snakes, just snakes are maybe a fairly normal thing, but for most people in the world, it's very outside the box, a very eccentric type of thing. So I like to hear people's stories on how they got here. So I want to hear about how you got into snakes and snakebite in particular. And is this something that started way back when you were young, or something that kind of happened later in life? How did that all come together for you?
Yeah. Well, I'm a twin, and my funny how I ended up in the world of snakebite and trying to find solutions to help the snakebite victim, because as a kid, I ran the other direction. My twin was the one who would catch him, and he should be in my seat. So no, in meeting so many people in the last decade of being in this community, of all the experts and the enthusiasts, and there's so many people that are so far above me in terms of their knowledge and their love. I was just like you. I was the fearful, but always a little fascinated. Ricky Tikki Tavi, all the childhood cartoon. It was great to be on the other side of the screen to watch the snake. But no, I really had nothing until my phone rang about 10 years ago.
Yeah. So what were you? We talked a little bit beforehand, so I know a little bit of the story. So maybe talk about your career and how that developed before that phone rang, because it's kind of relevant to what the phone call was about.
Well, I've learned serendipity. When a phone rings, it's always led me to something else. I've never, I've only applied for one job in my life, and that was to have the dream that I always had, which was to be a television producer. So I grew up in the San Francisco Bay Area when local television was all the rage. You only had 3 or 4 channels, and you had your local news, but you typically in most markets had the local program that was celebrated the Bay Area or celebrated your community, the people, the places, the history. And so I always wanted to work for this show called Evening Magazine, which was really the pioneer of the magazine format television show, which later was actually the roadmap to launching shows like Entertainment Tonight, things like that. So I, grew up in San Francisco and up in a little town up in Northern California, just north of the Golden Gate Bridge. And I was fascinated by, this show. And I went down to college in Southern California, and I said, I'm going to get a job when I get back when I graduate from UCLA. And sure enough, came up north, applied for the only time I've ever applied for a job, got into the television station, CBS television there. And they had taken Evening Magazine off the market while I was in college, replaced by the Inside editions, the hard copies, all that, sensational journalism at the time. And about 6 months after I got the job, we brought Evening Magazine back. And that started a, well over 15-year career of being a producer, telling stories of, quirky people, places to go, where to eat, the history. And it was just the best job I could have ever done. It was Mike Rowe, who's actually narrated, we'll talk about our documentary, but Mike Rowe, who does Dirty Jobs on Discovery Channel. Mike was my host on our show at the time. It was pretty much, we did the precursor to Dirty Jobs. We created 30 episodes of people around the Bay Area sucking out porta potties and artificially inseminating dairy cows. We actually we even did a snake removal. So this was probably since my childhood, it was the first time I had actually seen rattlesnakes and king snakes anywhere, and they were in a sewer drain. Oh. And of course, snakes would come up into the houses and such. So we actually did a rescue segment. These young kid that goes down in storm drains and rescues and removes and safely relocates the snakes. So Mike and I were all we did was, if anyone knows in the audience, he's got a sense of humor like no other. And, it was all about poop and scatology and, odd jobs. And we just cracked up and really had something. And then obviously he went on with Discovery Channel to take our idea and what we curated and went off and did great with celebrating American workers. And, I continued on for a number of years and just really loved that local program. And then like most good things, CBS pulled the plug. They wanted all their shows across the country to look the same and do no more local programmings. So, at the time I was like, what am I going to do next? And I was doing some marketing at a goat farm of all things. I was just picking up some small jobs, doing some pilots. And then the phone rang.
The phone rang. So who was on the other side?
So, it's a funny story because there was a family foundation here in the San Francisco Bay Area. They're the Lilly and Lincoln Foundation. Small family foundation. That the husband and wife who were running it, and the wife was the one who called me. They had inherited it from their mother-in-law, and she had just passed away. And part of the charter of the foundation, which her mother-in-law had done for years, was making documentaries and in short informational films on topics both in the U.S. and abroad that just were stories that had no traction, lacked knowledge, kind of to bring a spotlight on a variety of topics. And Barbara, who's the daughter-in-law, said, I don't know. First thing about making documentaries, and we've got to start doing this under our charter. And she had just been in the hospital here in San Francisco and met a doctor by the name of Matt Lewin, who during treatment told Barbara of this side project he was working on, trying to create a treatment that a farmer could have in their pocket to ingest if they were bitten by a snake. And Barbara was, excuse me? And then he went into the whole burden of snake bite, which we can get into. And she was wowed. And she called me up. I knew them. And she said, we have an idea for a documentary. Would you be interested? And I was like, snakes? Of course, I took 10 steps back with my fear. And she said, well, go away and do a little research, see, if this is something that would merit a story, because this doctor sure sold me on it. And I thought I'd take a few weeks of doing some research, making some calls. I got on it right away, and I called her back and said, let's do it. There was very little written. This is back in 2015. Very little written about the topic. There was some, handful of research papers here and there by what I became to know is, the 5 or 6 wise men who worked in snakebite in different parts of the world, who fought for solutions, and got nobody around the world from a higher authority to give a rat's patootie about it. So I got on the phone with a couple of these guys, and I was blown away. I was like, how could there be both a burden to human life and a crisis, and the world's ignoring this? How could something be so big and nothing's being done about it? And so I thought, well, maybe putting my storytelling hat on could lend something to something I really would never have had interest in if I was out looking for a documentary to produce.
Yeah, so they gave you kind of a very broad set of guardrails, if you will, just interested in a documentary on snakebite, and then you had the freedom to kind of research it and figure out what that would look like. Is that accurate?
Yeah, pretty much. It was like with any story, whether whatever the topic in my past, it would do your research and decide whether. And how many times in my life did I say, "Nah, that's not it. And then this one was like, I gotta do it. And I thought it would only be a typical go off and produce for 6 months, edit. Maybe in a year it's on a shelf, and next thing you know, you're moving on to the next thing. And here we are 10 years later.
Yeah. So you're going to develop this documentary, and I would encourage everybody to go watch it. We'll put a link to it in the show notes. And so why don't you kind of tell us the title and how you developed that title, as well as how you thought to kind of best structure the documentary itself.
Yeah. Luckily, I think really it was about putting a face on the victim. The first thing I wanted to do was to get to the parts of the world. Snakebite is endemic in 168 tropical and subtropical countries. So I knew there were plenty of places to film. And it was really to put a face on the different elements of what the victim goes through, to see the wounds, see the problems in the hospitals, and hear from these few experts that were around the country or around the world at the time. And it was the foundation was incredible. I mean, we were able to spend what we needed to spend to get to the places we needed to go, and to build a great team of photojournalists and editors and such. So, within about 3 months, we were on a plane, and we really wanted to focus on, wanted to represent the African problem. We also wanted to represent the problem in India. I mean, we'll talk about the burden, but we want to get a snapshot of what different regions, what the problem was and what mattered to them. Because you have to think that snakebite is an issue, and it claims the numbers are sketchy, but 125 to 138,000 are kind of the current numbers that are used based on estimates and surveys that have been done. But we knew that it wasn't just the deaths; it was the disability. 400,000 people, roughly, they say, are disfigured, have amputations, amputated limbs, PTSD. It's much bigger than just a death toll. And these are things that, injuries that a victim will suffer for their life. But it's a little bit different in different countries. The stories around treatment, the stories of, educating communities, it was different enough that we wanted to at least get a snapshot of different parts of the world. So we hit, as I said, Kenya, southern India, Papua New Guinea, Costa Rica. We also wanted to shine a light on the people that were actually doing things to improve antivenoms at the time. And that could be in Costa Rica, it could have been up in Liverpool, England. We wanted kind of a broad scope, and we wanted to also, in a sense, call out the blind eye that was turned towards snakebite at a global level. And, we had to dance carefully to not so much call out the WHO, but to say, hey, snakebite is a neglected tropical disease. It affects the poorest of the poor, farmers, herdsmen, housewives collecting wood for cooking, kids just out being kids. So not only do we want to shine a light on all of those people, but the WHO has other neglected tropical diseases at the time. This is back in 2015 that were, I think there were about 16 other NTDs in their portfolio that were well funded. There was a lot of programmatic work, but if you did the simple math from just the death tolls of these other NTDs, they didn't even equate to what the numbers were for snakebite deaths.
And the other thing about snakebite is it's kind of disproportionately more. I mean, some of this has to do with the distribution of snakes and so on. But,
sure,
in tropical regions, in countries that, are maybe, more poor on average. And, I'm assuming that's a reality.
Sure. Yeah. And so, I think when we hit the ground, and that's where this could have been a 12-year documentary. Oh, you asked right. Minutes to Die is the name of the documentary. But that title came months and months after I was back from filming, because it really is Minutes to Die seemed perfect because in some cases you only have minutes to die. Mm-hmm. But when we were on the ground, when we hit Kenya, we had some victims that were identified, some incredibly heartbreaking stories of survivors and parents that had lost a child to a snake bite, and the other child, the twin, was in the room at the same time the other child was bitten and has lifelong dysphoria. So here's a parent that has buried one child, has another child that they have to care for around the clock, which affects their livelihood. But we would be out filming this family's story, and we're just always amazed. And this happened anywhere we went. People would come up to us, they'd see the camera, they thought we were there to, save their town, or, we're there to tell the story. But people would run off into all directions, bringing other victims, or they'd say, come meet so-and-so. So the magnitude of the issue, once we hit the ground, everybody had a story. Everybody in rural Africa, everybody in rural India, somebody's been affected or they know someone. And then, you start just really seeing how much of an economic impact it is to these families who earn $1 or $2 a day. The key breadwinner climbing the coconut trees to get coconuts down, gets bitten and he can no longer climb his trees. Debt piles up in various countries. It's a little bit different, but, for the most part, patients will pay for treatment. And that can get into a whole nother topic of cost and such. But, if you're only making a few dollars a day and, a vial of antivenom is $25, $100, and you need multiple vials of antivenom, not including, the hospital costs, this puts families into debt, and they sell livestock and jewelry. And, if they even have that, they sell their land. And it was just seeing this all firsthand. It was like, you could have gone off and, as I said, made hours and hours and hours long documentary, because the stories are just gripping.
Hey everybody, I just wanted to take a quick break and tell you about an urgent issue facing one of the most incredible tortoises on the planet. The Seychelles Archipelago, a crown jewel of the Indian Ocean, is home to breathtaking natural beauty and unparalleled biodiversity, but a looming threat now endangers one of its most iconic species, the Aldabra giant tortoise. A new luxury development on neighboring Assumption Island threatens to unravel centuries of conservation work, putting these gentle giants and many other species at grave risk. You can make a difference. A global movement is rising in defense of Aldabra's fragile ecosystem, and you can stand with conservationists fighting to protect one of the last great sanctuaries of the giant tortoise. Visit www.friendsofaldabra.org to learn more and sign the petition to make your voice heard today. How was it received? What kind of feedback did you get? And did it have kind of that desired effect that you were looking for?
Yeah, well, obviously the first thing, when we came back with all the footage and, the story kept evolving. So, at the time, WHO was, there was movement starting to happen. Doctors Without Borders had put out a press release kind of a few months after we had been back from filming, put out a press release to call out the WHO. And thankfully they did it, and we didn't have to at that point. Call the WHO for just their neglect on the issue, and the fact that, Africa's main antivenom had just been, the company had taken the product off the market and stopped producing the product at the time. And Doctors Without Borders was basically calling out the fact that this is a crisis in sub-Saharan Africa. So here we were with this footage that we had just come back with. And we ended up putting together kind of like a little trailer that some of these snakebite godfathers that had worked in the issue, that they got this meeting at WHO, a side meeting at the World Health Assembly. And so we said, well, instead of just showing charts and graphs in your presentation, why don't we show them some footage? Because we have some gripping footage. And we did that. And it was that first little thing that told us, this wasn't so much about putting it on Netflix or finding a PBS channel to air it. We looked into all that in terms of how the world would see this. We knew just because of this advocacy piece we put together for WHO, and it got policymakers thinking about it, and member states of the WHO who are affected by snakebite starting to go, yes, we know this is a problem. Wow, there's a little momentum building. We figured what would be a great distribution channel was to get the film seen by the Gates Foundation, get the seen at tropical medicine conferences, at universities that focus on global health programs. So that was our angle, is just get the people that have some power in global health to know about the topic. And little by little, we screened the film when the film came out in 2017. We screened it at a tropical medicine conference down in Atlanta, and it was a packed room. And we did a little Q&A afterwards with a few of the folks in the film, and the woman at WHO who was starting to take snakebite on in her program. And gentleman walks up to us after the Q&A, and he worked for the Wellcome Trust, which is, the kind of like the Gates Foundation of the UK. Incredible folks that have actually put great funding into snakebite. But this gentleman walked up to us and just wanted to get more involved. And within 6 months, Wellcome Trust put out a pledge for 100 million pounds to revolutionize snakebite treatments and work on the issue. So, things were moving. There was like this momentum building. And I always remember people along the way that would, in other global health burdens, that would say, wow, you just told the story, and all of a sudden there's a snowball effect. And that's really what was happening. And the Lilly and Lincoln Foundation, I was working for them at the time to get the film out and the distribution and traveling around the world, getting it screened. But they were the angels in the earliest days to help WHO get a program up and running, funding them, funding me to keep being a storyteller, to create prevention videos in dozens of languages for India and Africa and Guinea and such. That, and we can get more into this, but community education is key to help turn the tide of snakebite. And so if we could give these community educators on the ground some tools, some video tools, take into schools, churches, villages, the foundation was just, hey, wherever you think there's need, we can help. And so we spent, better part of 3-4 years just kind of plugging holes in this new global health movement, both financially and funding conferences, ways for this new growing community to get together. There was, outside of Wellcome Trust, which was just focused on creating new therapeutics or funding, research in that realm, there was really no money. And the Lilly and Lincoln Foundation was like, all right, they need to have a conference here, we'll fund it. And I was kind of the guy who was running around the world trying to make things happen.
I love it. So, all of this this documentary spurred all of this action globally. How, so, you talked about, before we got into the documentary, you talked about the concept being a TV producer. Okay, yeah, I'll do this documentary on snakes, and then I'll move on and do my next documentary on whatever, dairy cow insemination or whatever it might be. and
that only happened once, and I was never going back to a dairy farm. More fearful of that than a snake bite.
But so how did you go from creating this documentary, working with the foundation, and kind of shepherding all of this, global action, to, the actual, kind of creation or get to the point of running the Global Snakebite Initiative? How did that transition happen from documentary to nonprofit?
Yeah, well, one of these experts I talked about earlier that had been working with not a lot of help, but a lot of heart, Dr. David Williams. He was a clinician. He was pretty much an all hands on deck snakebite advocate in Papua New Guinea, and developed a clinic there. Really worked on community education. Worked on a new anti-venom for this island nation. Got a transportation vehicle, snakebite emergency response ambulance to get out to the far-flung parts of Papua New Guinea. He was doing every single little thing that is needed in saving lives, and really in his years turned Papua New Guinea from I think it was around 25% fatality rate down to under 1% within the years he was there. And he had support from his home country of Australia and other things, but he started the Global Snakebite Initiative, and he was one of the guys that I met in the early days of telling the film. I spent time with him telling a story in Papua New Guinea and showing what works as a model for possibly other countries down the road to take on. But when David, because he's the well-rounded guy, he's a former herpetologist. Well, he still is a herpetologist, but he had the background that was needed to help the WHO take on their program. So David had to leave behind the Global Snakebite Initiative when he went to WHO, and he still runs their program to this day. And the Family Foundation at the time, we'd done 5 years of, funding and programmatic work, and they were, just ready to move on a little bit from snakebite. And this was the pandemic hits, right? In May of 2019, WHO, after making this an official NTD, getting member states behind it, in May of 2019, WHO launched their roadmap, their strategy to reduce snakebite death and disability by half through 2030. And, David was obviously busy at WHO. When the pandemic hit, they were doing anti-venom assessment work, which they still do. But there was this lack of, I guess, having a charity. There was a lack of advocacy. There was, to do the ground programs that needed to be tackled, like healthcare training and community education. I just felt like that was the next chapter. And to take GSI on, he had it founded in Australia. I started as a charity in the US, which wasn't easy to do in a pandemic. When,
I bet.
Normally just getting registered as an IRS charity, as a public charity, usually took a month or two. It was a year. And so, and I was still had my hands deep into solutions and funding things. And then we got it off the ground in late 2022, and still trying to get people interested in the cause and the mission.
So, and you, you've been helping with that. Obviously, you helped create it in the U.S., like you said, but you made the decision that you were going to dedicate a chunk of your career or life to this and kind of move away from what you had been doing. I mean, that's pretty big decision. So, this, obviously the snakebite issue, I'm assuming, became really important to you. Beyond just that documentary, it became something bigger in your life. Is that fair to say?
Yeah, absolutely. And I think, whether it was first the victims, the people on the ground that you wanted to tell the story for, and then find solutions for, to make hopefully life a little bit more manageable for them. It was the people that worked in snakebite. I said earlier, you've got your 5 or so godfathers of snakebite that were working for decades, but there were so many people on the ground that worked in community education that had maybe a training that they had developed to train doctors, but they had no funding. And that was the big thing. I think that's the thing that motivated me, was that, a community educator in India who could very well take their prevention programs to, teach villagers how to prevent a snake bite around the home, in the workplace, how to get straight to a hospital after a bite not to visit a traditional healer, get straight to a hospital. All the messaging that they had at their fingertips that they go out to community after community to try to do, they didn't have money for bus fare. They couldn't take their programs further. They couldn't pay for a night in a hotel because they're hundreds of kilometers away from where they live. So it was just, we're having a projector to beam their messages up on the school wall. So it was, I think I was really moved to do GSI to help support all these folks on the ground that were also being overlooked, to give them some sort of leg up to do their work.
And so to give some context before we get into some more details on GSI's programs and how you guys kind of implemented that mission and that kind of vision going forward, I think you did a pretty good job of kind of describing the burden of snakebite as you talked about. You talked about 130 some odd thousand deaths a year. You talked about another 400,000, kind of deformed and just seriously,
disabilities,
injured and dilapidated, whatever you want to call it, people in the world. So it was a real significant number of people. One thing you didn't talk about was, you talked a lot about communication. I guess you hinted at it, but we talked about the geography of this problem being oftentimes largely tropical. Many venomous snakes live in that region, but also, the idea of the kind of wealth of a country and how that relates to snakebite treatment. But what is the current status, or even the status as of the documentary on how snakebite is treated in some of these places where it's the biggest problem? Do they have good snakebite treatment? Is it a communication thing, as you've talked about? What's that whole treatment side of that background?
Yeah, well, I think maybe if we take a step back and we think of, we know the magnitude of the problem. 5.5 million people are bitten every year. So if you think of that magnitude, you start looking at, and India has 60,000 deaths a year.
Wow.
So you start thinking of the burden, and, if you look at the rural farmer who gets bit while they're out in their field, let's say they go to a traditional healer because it's customary. So their time to get true treatment is delayed. But let's say they know because somebody's done a community education program in their area, and they know to get straight to a hospital. Well, there's still problems because in most places you have geography. You have, I'll use a point in Kenya to kind of bring the story to life. There's a small dispensary out in, rural part of Kenya that I visited. If you live in the purview of this dispensary out in a village, maybe 20 kilometers to get to this little dispensary. And inside the dispensary is a young medical officer who's never had training in the treatment of snakebite. Although the basic ABCDEs of emergency medicine, do tie in the airway, the breathing, circulation. They do have tools, but they haven't made the connection about, I can use some of my training on snakebite treatment because they actually fear treating a snakebite patient. And that, no matter what country it is, it's super common. They lack the training, and they fear the treatment. And they even fear, maybe if they even have antivenom, which is another whole issue we can get into. If they have antivenom, they're probably fearful of administering it because, depending on what they have, many antivenoms can cause anaphylactic reactions in a patient. So they're fearful of all the extras, the extra layers of treatment that need to go on. So you get to this dispensary. They don't have antivenom. He's not trained. But but he refers a patient to the nearest hospital, which is 100 kilometers away. That's the next level referral hospital. Well, guess what? From this dispensary, it's 6 kilometers to that main road and another 94 to that referral hospital. But halfway on this 6-mile trek, and transportation's an issue, be lucky if there's somebody with a motorbike around. Typically, a victim will walk or will be carried. So on this 6-kilometer stretch, there's a river in the middle. It's the Galana River. And it's just representative of what's so common around the world, geographic land barriers. In much of the rainy season, the river is swollen. You can't cross it. It's the only way to get to the main road. It's crocodile infested. They have a pulley system to get you over, but the pulley's been broken for a few years. So imagine with minutes to die, you're trying to get treatment. And these are the common problems. You may get to that referral hospital eventually. If it's a black mamba and, a neurotoxic venom and it's pulsing through your body, it's truly minutes to die. Other snake bites, depending on the venoms, you have more time and it's maybe necrosis sets in. Again, we can get into all that. But let's say they get to that hospital. What if they don't have antivenom? What if that healthcare worker is also fearful? Our thing was to say, all right, let's take the simplest factors that can be mitigated, which is to help treat or help train doctors at all levels and to help educate villagers on getting straight to a hospital. So those were kind of the core issues that we wanted to do with GSI. And there's lots of people around the world that are fighting for the same thing. And it's really it's a money issue. There's just not the funding for snakebite that other global health burdens are lucky enough to have. And that's just really just pounding the pavement for advocacy and trying to get the funding just to, train a doctor.
Yeah. That's a good transition to talk about GSI's programs and how you try to solve or help with these global problems. And so I was curious how the programs are structured. So it sounds like it's primarily really kind of an outreach and education focus. I mean, is there any focus on, say, more directly on like anti-venom and making sure that there's adequate supplies and, other approaches to snakebite in these places? Maybe kind of give us a high level overview first of the programs that you guys developed at GSI to deal with this issue we've been talking about.
Hey everybody, I just wanted to take a break and tell you guys that snakes are one of the most persecuted groups of animals in the world, but we are dedicated to changing that. The Orianne Society works every day to ensure there's a future for these amazing animals. If you care about snakes, wildlife, or wild places, and you like what you've been hearing on the Snake Talk podcast, support us today by donating on our website at www.orianne.org.
Always going to be funding dependent. And, we were lucky enough to get funding for a program to improve the current products on the market in sub-Saharan Africa. And I can't go into much detail, but we're kind of at the tail end of a 2.5-year grant. All I can say is we're over the moon with the outcomes that we're seeing. And if you get bit by a cobra or a mamba in sub-Saharan Africa, the main product that is registered in at least most of East Africa is great for vipers. If you're bitten by a cobra or mamba, you may need 25 to 40 vials. And that stock is probably not even in a hospital to begin with. So the idea was to purify and make a more, a product that could neutralize the cobra and mamba venoms down to hopefully 1 or 2 vials. I can't get. I'd love to. Hey, we'll talk again in a year. I'd love to get into the deets on it, but it's looking like that's possible, along with some other production steps that can help the manufacturer that's currently registered to improve their product. Which, the antivenom manufacturers that are around, the money for R&D is not there because the cost of production, it's not a profitable business. So as a charity and through kind funding that we had for this program, our hope is to help this manufacturer improve their product by giving them the recipe, the steps. So I think that's something to, while there's all these, future technologies that are being funded left and right for snake bite, and all we want, no matter who comes up with the product, we just all want to see success. So we're getting a little closer on that. But another thing is funding community education projects around the world.
Yeah, talk a little bit about those. You have some links on the website, and again, I'll have that info linked in the show notes. But maybe talk about some of the projects that you've been doing. You've already talked about how snakebite in general varies quite a bit. I mean, there's some similarities across the world, but it does vary quite a bit. So maybe talk about some of those communication-related projects in different geographies.
Yeah, well, we, I think the main thing was to empower, where we could, community educators that just needed little sustenance funding to get out further geographically to do what they do best. So through grants, helping these community educators. And I wish it was more. And, it's funding dependent, but it's to give them the tools to go further, but also projects that come up. Say in Rwanda, we were able to fund the research into how public service announcements on rural radio could get this kind of messaging far and wide out to people that, a community educator couldn't reach a remote village, but they all listen to radios. So to get prevention messaging, awareness messaging straight to hospital, no traditional healer, all that kind of messaging. So we were able to fund programs like that. And it's really the other side of it is the training of healthcare workers. And that's, I think, the big, it's a big benefit for a very low cost. When you think of training a healthcare worker, it's expensive maybe to bring healthcare workers to one place for a week-long intensive training on snakebite. But, we are working on a pilot project in Kenya to do a traveling training program where a trainer will go around the country, hospital to hospital, clinic to clinic, and spend time on site training healthcare workers. And it's, it doesn't cost a lot to do that. So it's making sure that, a healthcare worker is competent and confident. And we put on, as part of all this and part of our work, we ran a conference, snakebite conference in Kenya this last year. And it was to bring together not just the experts in community education or clinical management of snakebite or conservationists. It was also the people on the ground that had a program that they wanted to learn from other experts in other countries around East Africa. So we brought them all together. And we also did a training, healthcare training for young clinicians. And I mentioned the dispensary earlier on the other side of the river. Mm-hmm. This young medical officer who just feared treating a snake bite, or at least didn't have the knowledge to assess a snake bite victim that came to his door. We brought him out as one of 40 doctors from around the country that we brought in and paid for. And when they left there, just by having this, 3-day event, they went back to their villages more empowered, more knowledgeable, more competent, more confident. And that's really what it's about. So if we can, train healthcare workers left and right, if we have the funding to do that, it's it matters. Mm-hmm. Just even a little knowledge is better than none.
Yeah, I like that approach. So you're doing like the community outreach, so people know how to get to appropriate, effective treatment, and then you're training those people that they're going to be coming to make sure that you have all these people trained in snakebite treatment, even in small villages, and then you're also working on kind of the treatment side of it, and what the future of kind of the what's it called, the medicine side or the treatment side for the bite. So I like that kind of three-pronged approach, and sounds very strategic, and glad to hear you're having some success with that. So what do you kind of view as the future of snakebite treatment? Are you optimistic where it's going? Are you pessimistic? What do you think big advances might be, areas that people really need to focus on? I mean, it sounds very clear that we need more resources, on this issue. You've talked about funding multiple times in the episode, and more focus from governments and agencies. But what do you think the future is for snakebite treatment?
Well, I think everyone's hopeful that the funding Wellcome Trust has put to a number of organizations around the world for development of these new technologies. I'm all I can be is hopeful, right? I don't come from a science or science development background. I've seen a lot of money spent and not a lot to show for it. So, as the old journalist in me, I could be a little bit pessimistic from time to time of, this product, we should have this product on the market in 3 to 5 years. 10 years later, it's never seen the light of day, So as an outsider, then I still feel like I'm an outsider in a sense. I am a little pessimistic, but I'm also very optimistic because there's a lot of great news coming out of the Wellcome funding to all these different organizations. So I really feel like one or more are going to be successful. But still, it's hey, if the Gates Foundation supported even in a small way snakebite, if other global health funders supported snakebite in a little way. Right now, it's really the Wellcome Trust. Mm-hmm. It was the Lilly and Lincoln Foundation in the early days to seed the movement.
Yeah.
And there hasn't been, the angels that have come to snakebite. So, we can do stuff on with grants and small dollars. But, snakebite's always looking for that angel or angels. And until those funding angels come about, again, snakebite is a funding issue. And there needs to be more folks to come to the table to support it, also on a programmatic level. And, with WHO losing funding from the US, which is current events, that doesn't necessarily bode well for snakebite. But snakebites at the WHO is funded separately. But, from a global health standpoint, you don't know where things are going. So, if that could mean snakebite might be on a chopping block. So it's kind of an unknown time in global health as well. But what doesn't change is the fact that no matter what happens, you can still put on a training program to train a doctor. You can still bring awareness and prevention messaging to villagers.
And I would encourage all of our listeners here to again, we'll have the link in the show notes, but to go to Global Snakebite Initiative's website, and you can easily see how to donate there to help support this mission of educating communities and educating healthcare workers, and just kind of helping this global snakebite burden. So before we begin to wrap up here, one last question for you. And so, you didn't come to this world as a snake person, right? You came as a TV producer, and there's obviously a real focus, and I can hear it in your voice, and all the actions that you've taken, like a real, you care about these people in these communities. So, and you had a fear of snakes when you were young. You know where I'm going with this question. So I'm just curious how this whole journey, what's your kind of perspective on the snakes? You're seeing all this damage and death that they're causing. Has it increased that fear, increased, kind of negative feelings towards them? Just, how have you been thinking about snakes throughout all this journey?
Well, I think the first months of being on the ground and filming, still petrified, right? But of course, you put a lot of insurance into to making a film, so we had to be protected with safety glass and boots and all this stuff. But it didn't change the fact that even being in the Liverpool School of Tropical Medicine, watching a milking, didn't freak out. I think finally when I was sitting in the editing room for months, they were behind my screen. And I slowly started to see their beauty. I started to have a different appreciation for, I'm sure a lot of people in your audience know the great Ram Whitaker from India. Getting to know Ram and his love of these creatures, his lifelong dedication to conservation and the coexistence of human and snake. It changed the game, right? I can stand right next to a black mamba and have coffee, It's it's just and I'm glad that the folks that preach prevention and community education also really adopted the conservation messaging. And I know you've had Michael Starkey on from Save the Snakes. The colliding of the snakebite people and the conservation people and building that messaging as to what goes out to communities. I think that's also what's made me love the snake even more. It's understanding human-wildlife conflict. I didn't know that. The only human-wildlife conflict was, me and a dairy cow or going down a storm drain to rescue rattlesnakes, So a lot's changed.
Yeah, that's great. Well, as we begin to kind of wind down here, I like to have all of my guests tell me a snake story. I like to have them tell me their best snake story. So, James, you have a snake story for us today?
Like the black mamba that chased us.
That's a great one. Let's hear it.
Well, yeah, filming one of our prevention videos in Kenya. This is after we made the documentary. Of course, we had snake handlers. We were protected with our boots and stuff, but we were trying to show how a mamba could be up on top of the hut of a home, up on the straw of a home, and get into the house through different parts. So handlers put the snake up and put the mamba up on the roof. We were far away. Well, the snake had other ideas. So it slithered down off the roof straight towards the camera. I think it wanted to be in pictures. The movie star snake. And thank God for the glass, but a couple people jumped even behind the glass, and the glass moved, and the snake got under the glass, and it was panic until the handler got to it. I saw my life flash in front of my eyes at that time, but I mean, that's just one off the top of my head, but
yeah, pretty.
is that good enough?
Sounds like a pretty exciting moment there, one you won't forget. So great. Well, again, I just want to encourage everybody in the audience to go check out Global Snakebite Initiative. Donate. To their cause. Watch the documentary Minutes to Die, and I just wanted to thank you, James, for being on the podcast today. I enjoyed the conversation and learned a lot.
Hey, thanks, Chris. I mean, it's all about awareness, but you have listened to a lot of your podcasts. You've got great passion, so thank you.
Great. And I just want to thank the audience and tell everybody to remember, snakes are animals too, and it's a privilege to see one in the wild.